I want to thank everybody for being here today. We're actually right in the middle of the defense authorization markup, so I had hoped to be here for the whole event. I'm going to offer my comments and then hand things off to my very capable colleague from Massachusetts. Most of us know that the opioid and heroin epidemic has now become a national crisis, and we know this because we see it in our states and in our communities. Sometimes we see it in our families. I've personally had several friends who have lost family members to this epidemic. And in recent years, drug overdoses have become the leading cause of death for Americans under 50. I think that's an incredible statistic. Last week, we learned that 1.3 million Americans needed hospital care, either inpatient or emergency room, for opioid-related issues over the last calendar year alone. And like many of the senators up here, my home state has been just seen far too many of these overdose cases. Too many New Mexico families have lost loved ones. Many more are struggling to find treatment and recovery resources for a father or a mother, a son, a daughter, or themselves. And it's clear that our communities need more resources to provide comprehensive treatment and rehabilitation, not fewer. A large part of the funding equation for states trying to confront this public health crisis comes directly from the Medicaid program. And that is what we're concerned about, because that is what will be dismantled by this Republican Senate health care bill. I recently got a chance to visit the Endorphin Power Company in Albuquerque, New Mexico. They are a transitional housing facility for people experiencing homelessness as a result of substance abuse. I met with first responders who are on the front lines of confronting this epidemic. Before we passed the ACA, law enforcement were the first to tell us that our healthcare system was failing people who needed mental health services and substance abuse treatment. Someone with a behavioral health problem was far more likely to be sent to an emergency room or even a jail cell than to get access to evidence-based care. Today, because of the mental health parity law and because of Medicaid expansion, affordable evidence-based treatment is more available to those who need it. A lot more must be done, but the massive Medicaid cuts and the waivers for essential benefits in the Republican bill would reverse many of the gains that we have made in states over the last few years. And it's important to say that grant dollars will not fix the devastating blow that defunding Medicaid would have on our treatment options. You wouldn't treat cancer with a grant, and we shouldn't be reliant on grants to treat the epidemic of opioid abuse in our country. Last year, I also got a chance to tour treatment centers up in Rio Arriba County to hear directly from people who have recovered from the trials of opioid addiction. In New Mexico, Medicaid pays for 30% of opioid medication-assisted treatment, 30%. This is the evidence-based treatment that we know for a fact is helping people lead productive lives again. In states like West Virginia, Ohio, Kentucky, Medicaid pays for nearly half of those treatments. If Congress passes this devastating funding cuts to Medicaid, like the ones treatment centers like the ones I had a chance to visit in northern New Mexico will be devastated. That would spell an end to any progress that we've made so far in fighting our nation's opioid and heroin epidemic. President Trump knows this crisis is tearing apart American families. He promised on the campaign trail to end this epidemic, but even members of his own White House Commission on Combating Drug Addiction and the Opioid Crisis told his top advisors this month that Medicaid is the leading national payer for addiction and mental health treatment. Majority Leader McConnell knows that his own state, home state of Kentucky, desperately needs the funding from Medicaid to address the opioid crisis. And the same can be said for many Republican senators who have seen this epidemic shatter communities in their states. It is nothing short of hypocrisy for them to say that they are taking this American public health crisis seriously when they're pushing through a bill that will slash Medicaid funding by hundreds of billions of dollars. No amount of grant funding that the majority leader or President Trump can point to is going to make up for those kinds of cuts. I sincerely hope that enough of my Republican colleagues hit the pause button this week to take a look at what's actually in this disastrous bill. Maybe then we'll start to understand how devastating this will be for the communities that they represent, and maybe then we can get down to the hard work of solving the problems in healthcare that we all recognize do exist. I want to thank you all for being here on this incredibly important topic that's so close to many of us. Senator.